IUI, otherwise known as intrauterine insemination, is where we take the sperm, wash it up, clean it, take a catheter and basically give it a ride up into the uterus, bypassing the cervix and increasing the number of sperm that we get in contact with the egg.
The timing of the IUI is very critically important. We want to time the IUI so the living sperm are there just before the egg is released from the follicle. It's what we call ovulation. And we can actually do that down to almost an exact science within several hours of when we would anticipate the egg being released with ovulation.
Ovulation induction, otherwise known as OI, or even superovulation at times, is the process by which we stimulate the ovary. Now we have multiple ways of doing that, different medications that do it, but the point of it is to try to get 1 to 2 eggs to grow, potentially more depending on how aggressive we're being, and it's the way we actually proceed with treatment to get the eggs to grow.
The success of the procedures depend on multiple variables. The biggest variable is the age of the patient. So the younger the patient, the higher the success with any of the medicines that we use in ovulation induction associated with IUI. As the patient becomes older, the eggs also age with that patient and the success rate gets less each month that we try. So you have to sort of strategize in these patients when they first come in, when we're going into IUI and ovulation induction, to what they're comfortable with, how strong the medicines that we're going to use, and what the success rate is based on their age and their history. Certainly the anatomy has to be intact. If there are tubal factors, then we may actually avoid this and go into things like IVF immediately.